Good evening, everyone. Welcome to my Aviofensis and welcome to the European Fertility Society. We are back with some more webinars, with some more topics. And today's topic is definitely an interesting one. It's still, I think, new topic. So we didn't have as many webinars on this. So I'm sure you will have lots and lots of questions. As you can see, our special guest is with us already. Maria Navas, a nutritionist from Barcelona, is here with us, and she will discuss whether probiotic treatment can improve your microbiome. Of course, she's the expert here, so she will start with her presentation on our topic. But as always, you will have a chance to ask your questions. And as always, Maria will be happy, I'm sure, to answer them right after your presentation. Yes. Hello, Maria. How are you? Great to
have you here. Good evening.
How are you?
Very happy to be here.
We are glad to have you because I can only mention that Maria already had a chance to be a presenter during our webinars in Spanish, and now she is here to support us and discuss this topic in English. So I'm glad that you decided to also join us tonight. And as always, remember, this is being recorded, so feel free to rewatch this after. It will be available, of course, next tomorrow. Sorry. And of course, remember, if you have any questions, this is your time. You can ask them to Maria. I'm sure she'll be happy to answer. I'm your host, Caroline, and I think that we can go ahead with our topic. I'm looking forward to this. It's always an interesting topic as well. So are you ready, Maria?
I'm ready. Yeah.
Brilliant. Let's go ahead then. Here's the presentation.
Perfect.
Thank you so much.
Thank you. So, hi everyone. I'm Maria. I'm a nutritionist. I live in Spain, in Barcelona, and I'm here to talk about this topic. And I have to confess that is my first time doing this kind of presentation in English. So maybe at some point I have some problems or I get a little bit blocked, but I hope it goes well. So first of all, I'm going to do a little introduction, okay, about microbiome and fertility and what role does it play? Okay, for example, well, not in our endometrium, and also maybe I get some words wrong, so I'm sorry in advance. So in our endometrium, we have we have a microbiota. Okay, the best microbiota or the most successful microbiota to get pregnant and for fertility treatments is to have a 90% of lactobacillus. That is a kind of bacteria. Studies have shown that women that have less, they have higher difficulties to get pregnant. Okay, it doesn't mean that if you don't have 90% you won't get pregnant, and it doesn't mean that you need this 90% to get pregnant, but it's just like a predictor. So we're going to talk about how to improve this microbiota. A part of it is probiotics, but it's not most of it. Okay, we can do much more to improve our microbiome apart from probiotics. And at first we will talk about what can we do and which impact does it have, and then at the end we will talk a little bit about probiotics and how to choose it and everything. Okay, so let's start. Here we have like a small introduction about microbiota. What can we do to know if our microbiota is in well shape or it's not that good? Okay, we can do, of course, we can do some tests, but the thing that we can always do, and it's free for us and it's really easy, is just to pay attention and take care. Pay attention. Which are the signs that may indicate that we have any kind of alteration in our microbiota? Talking about the reproductive system, I centered in like this, the microbiota that I'm talking about. It's always vaginal or endometrial. Okay, So if we have any vaginal discomfort, this is sign of alert, okay? If we have dryness, if we have itchiness, I think it's the name, itchiness, yes, or if it's inflamed, it means that maybe there is some microorganism in our vaginal canal, or yes, or in the area that shouldn't be there. Okay, so we have to pay attention if we have any discomfort and look and think what can it be. Also, digestive problems. Here, it's very something that it's very common. It's candida. When we have candida infection, in vaginal candida infection, in very repetitive occasions, maybe we should look our the digestive tube, okay, because maybe we have candida there too. So it's very difficult to get rid of the candida in the vaginal area if we keep it having in the gastrointestinal tube. So candida, it's not the only example, but it's very frequent example. So we have to also keep in mind that if something is not going well in a digestive level, we also have to think about our microbiota. What's really connected with our gut? It's our skin. Okay, so if we have rashes or redness or dermatitis or psoriasis, that's another sign that we could check our microbiota. And also tiredness, if we are moody, okay, or we are depressed, we have anxiety, all these things are signs that maybe there's something that's not working well. And what about taking care of our microbiota? So this is something that I always say. We don't have to wait until we have a problem to find a solution, and we don't have to wait until we have a problem of any kind to take care of our microbiota. Now we will see what factors influence our microbiota, and you will see that it's something that it's from a lifetime. It's like long distance career. So it's true that if I make some changes today, I can see the results tomorrow, but everything I've been doing for the past years, even from when I was born, it has an impact on me and on my microbiota. So here we have a little bit of factors that influence on our microbiota, but I will show you this slide that it's more complete, okay? And we will talk about some of these factors that influence. It's the first of all is how we are born. It's not the same being born in from the vaginal canal, or by a C-section. If we are born by a vaginal canal, the first things we will get in contact will be our mom's microbiota. Instead, if we are born by a C-section, the first things we will get in contact would be our doctor's gloves, the medicine instruments, and all these things that are always really clean, no microbes, no bacterial, and it's not the best environment to be the first one. Okay. Also, something that is really important, it's breastfeeding. It's not the same to have like mom's breastfeeding or to have formula breastfeeding. Okay, when we have the mom's breastfeeding, we are receiving also a lot of microbes, so, and food for these microbes. Okay, instead, if we are fed by formula, we will get food and we will get a lot of things interesting, but it's not the same, and this will leave an impact in our baseline microbiota. And then when we grow up, this baseline can change. But if we have a really good baseline, that it's how we are born, what we are fed, where are we raising up, it's not the same to go to school or to be a homeschool child, because if you don't get in contact with other microbiomes or other kids that are sick, your immune system will be like a little bit not that strong, and this will have an effect on our microbiota. Also, Also, it's not the same to live in a city or to live in the countryside, to live with animals. The best thing that we can give our kids is contact with nature and animals, okay? Also, something very important is antibiotic therapy. If you're someone that takes antibiotic like maybe 3 times per year, it's important to take care of your microbiota. Or maybe if as a child you were taking a lot of antibiotics, so it's also something we have to keep in mind. Just, you know, think about it. Also, if we take a lot of stomach protector here in Spain, it's something like if you have any trouble in your like reflux, most of the people they go and take stomach protector. If you take a lot, this can have a bad effect in your microbiome, your microbiota in your stomach, in your gut, and this can get translated into your vagina, and then endometrial. Okay, it's at the end, it's everything is connected. So we have to take care of our gut and have a really nice gut health. What else? Of course, what we eat, it's very important. It's because what we eat will feed us, and but it will also feed our microbiota, not only in the gut, also in the vagina. Okay, it's very important, and in our whole body to eat good, like have a nice diet for our to avoid nutritional deficiencies, and also for this hormonal alteration. Okay, when we have like like an up and down in our for a hormonal situation, or maybe some medications or corticosteroids, yes, this can be a trigger to have a microbiota problem. Okay, what else? Surgical interventions also, because they come with a lot of medication, alcohol, drugs, anxiety and depression. Like it's very connected also gut with psychological health. What else? The profession and the exposure to toxins. If we have a profession that every day we are exposed to some toxins, we have like high probability that this affects our microbiota. Okay, because maybe there are some toxics in the air, like that's the same if we live in a city. There are some toxics that they will kill our good bacteria. What else? Well, as you can see, there's a lot of things. If there's something that I haven't mentioned and you have like special interest, you can ask in questions and we will answer later. And then before continuing, something really important, because sometimes like it's different terms and it's easy to get confused. Probiotics are the small in the capsules with bugs, okay, like the little microbiome, like bacterial and whatever we take. Then the prebiotics is the food for these bugs, okay, and postbiotics is bits of dead bugs. Maybe I cook something with yogurt that has these bugs, okay? And when I cook it, the bugs die. But I will have these little bits of the dead bugs, or even the whole bug but dead. This it's been it in studies have shown that it has an effect on us, okay? What else can we do with the microbiota? Microbiota transplant. It can be fecal or vaginal. Vaginal is not very practiced, at least in Spain. And fecal in Spain, I wish it was more practiced, but not that much. Okay, it's like in very specific situations. But there's something that it's something that it exists, and we have to know what it is exactly. Okay. Mm, the vaginal transplant is being tested for like some women that have um, dysbiosis, yes, like microbiota alteration in a vaginal level, that it's really hard to restore this microbiota. If they have tried to do like a vaginal transplant, because they take some microbiota from a healthy woman that she has this 90% of lactobacillus, and they put it in the woman that has the problem. Okay, so maybe the situation will get better. So what is something that it's really easy to do, and it will have a really good impact on our on our microbiota. So here we have this slide. I'm sorry because there's a part of it that it's in Spanish, but this is something that I'm sure you've seen. It's the hard bar plate, to have a healthy diet. Okay, it's a really easy way to see it, and I like to work with it because it helps me to explain what different groups and the paper that the role it plays, the different groups of food, and how they affect our microbiota. So I will explain this like a little, not very. It's not gonna be very long. At first, we will have the vegetables. So it's very important to eat veggies, and the best thing we can do is to eat it in all different colors, all different kinds, different way to cook it, as much like more the best. So half of our plate always vegetables. Why? Because they will bring us minerals and vitamins and fiber. Okay, fiber, it's one of the principal foods for our good microbiota. So the bacteria that we want to have, they eat mostly fiber, and then some other molecules that comes from the color of some vegetables and some fruits. Okay, like the blueberries. I don't know if you've heard that blueberries are really good for our microbiota, but blueberries and all this purple color, it's good for our microbiome. But anyway, all the vegetables are good for us. Then we have the carbohydrates. Okay, sometimes when people come to my clinic and they ask for a diet for like for focus on fertility, there's a little bit of question like, should I eat carbohydrates? Should I eat or avoid gluten? So what's important? The important is the amount and the kind of carbohydrates. It's not the same to have whole rice than to have white rice, or even to have corn, in a canned corn. I don't know if that's the name, that it has sugar added. That's really not good. Then instead, the brown rice, it's really good because it brings a lot of fiber for our microbiomes. Yes, and and personally, I recommend it. Of course, every case is different, and we will see how it works and what should we do. But we don't have to eliminate like directly. Okay, what about gluten? Okay, so gluten can be inflammatory, and something that I haven't said is that the best diet in this situation would be an anti-inflammatory diet. Okay, we like in an ideal world we would always be having an anti-inflammatory diet, but in some moments of our lives this anti-inflammatory diet might be more strict, and maybe this is one of these moments. So should we eliminate gluten? Maybe this would be a good time. Okay, because some of you may say, no, but I eat gluten and I have no problem. Okay, but maybe for 2 or 3 months that you are in this process might be something positive for you and for your microbiome to from the whole system, to avoid these small triggers of inflammatory reactions, even if they are really small. Okay, what else? The carbohydrates also, it depends of the timing and about what do we do. And then proteins, the amount of protein, it's really important to eat the correct amount. Okay, like in my clinic, I see very frequent lots of women that they don't eat enough protein. So it's really important to have protein in all our meals, even in the breakfast. Uh, lunch and dinner, okay? Always proteins. Here, it's 1/4 of the plate, like in the Harvard plate, it's also this amount, this proportion. But if you put a little bit more, it's fine, because it's very important to have the right amount of protein and the right quality. It's not going to be the same to eat the meat from a chicken that has been raised in the countryside, free, and that has been fed like really good food, that a chicken that has been mm, produced in a farm, very stressed, with a food that is not that it doesn't have this good quality. Okay, this will impact in the final food. And also, what about the dairy? No, sometimes you may have heard that we should limit the dairy, milk, yogurts, cheese. That's the same as the gluten. Maybe you think that it doesn't make you sick or it doesn't affect you, but maybe in this period of time would be a good moment to maybe retire for some time, and then if you want to eat it again, it's fine. Always the best quality possible, but yeah. But in this process, maybe sometimes it can be better to avoid it. And fats, always, it's very important. I put it in capital letters, always, also in every meal, okay? And high quality fat. It's not the same to eat processed food with some processed fat that to eat um, an avocado. Or here in Spain, we use a lot olive oil, extra virgin olive oil. These fats are really good. They help us to anti-inflammate our body, okay? And also, it's everything that is anti-inflammatory. It will help us to have a better microbiota, okay? And then, how should we eat? Well, before this, I just want to say that these recommendations that I gave, it's like recommendations to have a good microbiota in a general way. Then everyone is different and every case is different, and maybe some people will have to eat more proteins and another will have to eat more carbohydrates. Everyone is different, but what I'm talking here, it's more general terms. And how should we eat 2 or 3 meals a day? Okay, I don't know in your country, from wherever you're listening, but here in Spain there's like a really strong myth that we have to eat 5 times a day, and this is not true and really not healthy from a microbiota point of view. Okay, if we are not talking about microbiota, we could accept it maybe in some cases. But if what we are trying is to have the best microbiota, my recommendation is to eat from 2 to 3 times a day. What else? Plenty of colors and spices. Why? Because, as I said, some of these colors will be food for our microbiomes. And even if it's not food, like if it's not a direct relationship, it have an indirect relationship. Okay, it will help us to have a better microbiota. Oily fish, it's oil fish. Yes, in Spain we say blue fish. It's like salmon, like greasy fish, because it's a source of this quality fat. Okay, what else? Individualized supplementations. Maybe you will hear some supplementations that are good. As I said, everyone is different. Every person is different scenario. So my advice is that if you want to take some supplementations, ask your doctor or the professional that is helping you. Then early dinner, this one I put it here especially because in Spain we are used to have dinner like maybe 10, 11. So this is a really important point in Spain. I don't know in your case. Mm, what else? 12-hour fast. I don't know if you're familiarized with intermittent fasting. It's true that it's a strategy that can help from an anti-inflammatory point of view, but during this period of time that like fertility treatments and when we are looking for to get pregnant, if we do a really long fasting, we have like the danger to not get enough nutrients. I don't know if you're understanding what I'm saying. So let's try not to do that aggressive intermittent fasting, okay? 12 hours, it's fine. And then what I always say in my clinic is if you recycle and you have different bins, yeah, like different places where you put your trash, and you have the compost one, the compost should be full because you should be eating lots of fresh products, okay, like vegetables, like if you eat animal food, like the animal, you know, not these burgers that they sell it already prepared, and these fishes that maybe they are not even in the shape of a fish. Like if you eat fresh, you will have a lot of compost. If you eat processed, your plastic bin will be more full. So just try to have your plastic bin not that full. And then talking about the probiotics, here I put like different studies, okay? That's something something that we have to keep in mind is that this word, this microbiota word, and these interventions are quite new. Like in the last years, there has been a lot of studies, but it's not the same as I have a headache, I take an aspirin. You know, nowadays, unfortunately, we don't know which is the best, how to do it. Like there's not a closed protocol. What we know is that there are some bacteria that are really good for us, like they help, like this one. I don't know if you see my mouse, but it's Crispatus, Rhamnosus, also Salivarus. These ones that you can see that they are repeated, it's because it has been shown that they help with fertility. And also, it's not also only fertility. We have to also watch the vaginal health, okay? Because when we have a healthy vagina and a healthy gynecological environment, consequently, we will have a better fertility. So when you look for a probiotic, my advice is to look the fertility, like the ones that are addressed to fertility, but also take a look at the ones that are addressed to the intimate health, intimate woman health. So here we have some studies, the one that I have signed, like with the arrow, it's because they talk about different situations. This one, the number 14, this intervention was in 3 days. Like my point of view and in my experience, the intervention should be a little bit longer, okay? As we can see, this one that it took 3 days, the outcome was the treatment does not affect the vaginal colonization of lactobacillus during oocyte retrieval and the embryo transfer, okay? Maybe if we did this same study, but in 3 months view, the results could be different, but unfortunately, we don't know. What else? Here we have another one that I put the arrow. This was 60 days, so this intervention was much longer, and they were looking to determine if these probiotic capsules helped the vaginal colonization of lactobacilli. And there was no difference in the colonization or the pH, but the NS, that it's an index of how they measure the vaginal health, improved. Okay, so as I said before, if we want to improve, like everything that improve our vaginal health will help us to improve our fertility. Okay, What else? This study that it's very interesting. 180 days in infertile woman. They were trying to assess the impact on vaginal parameters between women with reproductive failure and fertile women. Okay, and they were trying to evaluate the ability of Lactobacillus salivarius to increase pregnancy rates. You will see that I think like 99% of probiotics that are destined like for intimate health are made with lactobacillus, because as we said, 90% of lactobacillus means like better outcome, like yes, like better I well, yeah, it's better. And then what can we see in this study? That of course they saw that the fertile woman had higher presence of lactobacillus than the women that have repetitive miscarriage. Okay, and the oral administration of Lactobacillus salivarius led to a relevant number of pregnancy in infertile population, together with significant changes in vaginal health parameters. So this is like a long-term intervention that we could see some difference. And here we have some more. Okay, also 60 days. I would do it longer, but it's something that we have to keep in mind, that that's what I said. It's like a long-term work. And like if you're thinking about getting pregnant or to start this process, like there's no early time to start. Like as earlier is better. Here I put some probiotics that we can find in Spain and the most used. I don't know, like wherever are you listening from, you have these these brands or these pharmacies. But at the end, the message for this slide is, when you buy a probiotic, just look what's inside, okay, and look if it comes with something else. Because, for example, this one, the fertibiotic Mujer Plus, here in Spain, it's very used because it comes with probiotics, but it also comes with some other molecules that helps in polycystic ovaries. The Mio and Chiro, it helps, and they have a lot of some other micronutrients that they also help in this moment of fertility. Then we can see that there are a lot of strands, I think is the name, strands, yes, of bacterial that we can see repeated in different products, okay? And also sometimes maybe the best is probiotic, but we can see that there's a probiotic that in these studies we can see that had shown a good answer, like a good reaction to Gardnerella. Gardnerella is like a microorganism that it's like it bothers a lot when we are talking about reproduction. And if in your case you have Gardnerella, maybe it could be a nice idea to include a probiotic that has Paracasei, because there's a study that we can see it's a study that has seen some reduction. Okay, as I said, unfortunately, this is not the same. Like I have a headache, I take an aspirin. There's a lot that we don't know, but with the little things that we know, that's what we can do. And then yes, and then before I end, some conclusions and something that we have to keep in mind. Probiotics, we will choose the one or another depending on our situation. That's what I said. Like the fertibiotic, it's one very used, but if our case it's specific for Gardnerella, or maybe my problem is that I have Candida. So maybe I will choose another one, okay? So think, before choosing one, think and ask your professional and the person that is helping you which one is better. And then there's different options. You can use it vaginal or oral. Studies have shown that it's oral is better because there's two arguments. The first one is because there is more adherence to the treatment. At the end, it's much easier to take a pill than to take it via vaginal, in the vaginal way. And also that when the vaginal probiotics treatment ends, decolonization goes down. Instead, when we do it orally, when we stop the treatment, decolonization stays better. And also something really important that we shouldn't forget, it's the vaginal mucosa or the epithelium. I don't know how you say it in English in the right way. Maybe it's both, but it's okay. What do we have to think? It's like, it doesn't matter how many bacteria we put in our vagina, for example, that if they are not in, like, if they don't feel cozy, they will leave. That's the same, like if you go for vacation to a hotel that it's not warm enough, or in the summer it doesn't have air conditioning, you will leave. So we have to think that our bacteria, they do the same. If they arrive to the vagina and the pH of our vagina doesn't help them to grow, they will not grow, they will not get strong, okay? Also, if the epithelium is dry, it will be very difficult to them to adhere to the epithelium, okay? So we have to also work out this mucosa that in very frequently in fertility treatments, we can see vaginal dryness, okay? So we have also to think about this aspect. Not only the probiotics, we have to think like the global picture, like global health. And then don't forget the most important and easy thing, because it's easy to do, but it's not that easy to be constant, is an anti-inflammatory and prebiotic diet. What I'm saying is anti-inflammatory is like, when we talk about anti-inflammatory diet, it's what we're talking about is like a diet that that it's not gonna put extra pressure on our immune system. And if our immune system is more relaxed, it will have time to see, okay, in this endometrium, I'm seeing a bacteria that shouldn't be here, so I'm gonna fight against it, okay? And then prebiotic, remember, prebiotic, it's a food that we give to these little microbes. So eat food that will be food for the microbiomes that we want to grow in our body. What else? Lifestyle and rest. I like, I can't explain the high impact it have stress and poor sleep in our body. So if you are trying to improve your health, no matter what's the motive and no matter in what moment you are, rest and stress and lifestyle, like some sport and going outside, uh, having like 20 minutes of sun every day, okay? Going to the nature, with getting contact with animals and with other people, be happy. All these small things, they have a great impact in our body. So don't forget about it, okay? And that's all. Thank you for listening. I hope I didn't make big mistakes in English, and I hope you understood everything. And yeah.
Brilliant. Thank you so much, Maria. It was definitely interesting. Lots of information, but lots of useful information. So thank you so much for explaining how it works and what we need to take a look at for sure. And as you can see, many questions are right here. So now it is time for your questions, and Maria is here to help you. Remember that if you wish to get in touch with Maria directly, here's her contact details, so you can also ask about your specific case. But now I think it's best to go to our questions. As you can see, many of those are here. So let's start with the first one from Caroline. What is the best food to eat on day of embryo transfer and the following days?
Okay, so the best food is, I would say, lots of good fat, okay, lots of vegetables, like what we've been talking about, but like more strict, you know? Maybe during the month or maybe during the week before, you've been doing this, but not that strict. But when these days arrive, it's like, okay, no dairy, no gluten, just try to do it more strict. And of course, no sugar, no processed food, no weird ingredients that when we read the label of the food that we're gonna eat, we say, I don't know what is ingredient. Okay, so don't eat it.
As healthy as possible. I understand
Of course,
that.
yes.
Of course, makes sense. Thank you so much for your first question. Let's have a look. So, what about the period of hormonal stimulation? What's best to eat?
Okay, so during the hormonal stimulation, during this period, we might have a lot of stress, anxiety, and it's very easy and it's quite common from my experience that food it's like escape, like a way to disconnect. And so frequently the women who are passing this situation, they tell me yes, but and then I go home, I relax, and I eat my bread with nocilla, and I say, okay, no, I know that's what you want, but in this moment the best thing would be like have a nice breakfast, okay, like try to have anti-inflammatory, like everything anti-inflammatory. I don't like to say like anti-inflammatory diet because it's like very general, but it's at the end it's a very easy way to explain. So a nice breakfast, okay, full of healthy fat and quality protein, and then in the midday to have like the harvard plate, it's perfect. And then in the dinner maybe reduce the carbohydrates. It depends of the case. If you reduce it and you're still hungry and you know that you will go and eat that food that it's not that healthy, so put a little bit. But also always the most whole and the most fiber ones. Yes.
Okay, hope that helps. Again, thanks a lot for your question. Here we have a little bit of description of the situation. Yes, so let's have a look. Streptococcus found in uterus did 4 rounds of antibiotics and went down, and lacto went to 80%. Strep is now gone up to 63 percent again. Did 4 transfers of the euploid embryos, 3 failed to implant, and 1 ended in miscarriage. Where to go from here?
Okay, so let me see if I understood well. At first, the lactobacillus went up to 80, and then when the strep went down, the lactobacillus went down also to 63. Okay, so in this point, my advice would be to take care of course, the food, lifestyle, but don't stop taking probiotics and make sure you're taking the right ones. I think you're taking the right ones because if the lactobacillus went up to 80%, that's a really good number. If you're taking antibiotics, yes, I think it's a good number. Yeah.
Okay, thank you so much, Dolores, and best of luck. And of course, if you have any follow-ups, you know what to do. And there are some more questions. So how long before embryo transfer do you suggest to take vaginal probiotics?
Sorry. Okay, so my advice would be to why should you take vaginal probiotics and not oral? I think if you want to do it like as a prevention, I think I prefer oral probiotics because in case there's something that not working well in your gut, it will work too. And as we've seen, the oral one have a better adherence to the epithelium than the vaginal. And it yes. So I
Sorry,
think
yeah.
yeah.
Sorry, the next question was just about this, so I just wanted to show you, yeah? So what is better,
Okay.
vaginal or oral?
Yeah,
Yeah.
I think in my point of view and what evidence has shown until now,
Mm-hmm.
it's better oral. Okay. And about the other question that how
Oh,
often
sorry.
like how long before, I would say like if you have any suspicions that there's something that might not be well from the start, like it's never too early to work on your microbiota.
Okay, that sounds good. As always, right? This is encouraging, at least, of course. And of course, there's some more questions. So, can you prescribe good oral probiotics?
As I said, it depends of the case. Like
Okay.
I that's what I said. The fertibiotic in Spain, there's a lot of people that are using it, and it's working well, but it's not the best for everyone.
Mhm.
So
It's
the
always
best,
better to check with your
of
fertility
course,
specialist or someone who actually, or
yeah,
nutritionist, for example, as well,
yeah,
obviously.
someone
Yeah.
that knows your case and knows your situation.
Okay, that makes sense. So we are about to show the possibly final question. However, of course, if you have more, you know what to do. Oh, sorry, there is one more already. But let me show you. So it was really good, Maria. Excellent presentation. Well done. Can Candida albicans, I'm sorry, I'm not sure here, prevent implantation, and what's the anti-Candida diet?
Okay, so thank you, Anna. Yeah, Candida albicans sometimes can give some problems. Like I've had some patients that they had Candida, and with the diet and probiotics, we have improved the situation at the end. They got pregnant. So, like Candida, sometimes it's really hard to get rid of it, but it's the one that we have more information. And the anti-Candida diet would be a diet very low on carbohydrates, especially like no sugars. Uh, if you have to eat carbohydrates, like in very whole, like the brown option, and work a lot with fat, proteins, like have a very low glycemic index. I don't know if you are familiarized with this term. And then work also with some like medicine to kill the candida. That candida, it's a fungus, so antifungal medication. And sometimes the candida gets really hard, and then you can work with some herbal therapy. And yes, and also help the repopulation with probiotics. So these are the three things you should uh, keep in mind with candida.
Okay, again, thank you for the explanation. And Anna, thanks a lot for your question. And let me check. Yeah, Anna would like to thank you for your answer here as well.
You're welcome.
Thanks a lot. And the next question is, would you suggest a biopsy of the uterus, EMA test, to test the microbiome? I did this test and lactobacillus was 6%. That was tested after 5 fate transfers.
Okay. So, okay, you did this test already. Normally, when I have these kind of situations, at the end, at least in Spain, I don't know how it works in the UK, these tests are really expensive. And like I tell the patients, okay, you know that you had like a really low percentage of lactobacillus, because 6%, it's not a good number, unfortunately. And if you had 5 failed transfers, my advice would be like, make sure you're working well on your microbiota, okay? So you don't waste your money in to have a similar result. And once you've been working on your microbiota and you think that there's some changes, and maybe as we've seen in the studies, like the ones that the intervention was in 180 days, the results were much different than the ones that were in 3 days. So maybe if you have time, work for a long time, like a long time, 2 or 3 months, and then maybe you could do another time the test or try another transfer. You have to think which decision is better for you.
Of course. And sometimes just takes time, and it's better to repeat it after some time rather than just do it. And yeah, that makes sense, of course. Thank you, Cassie, for your question. Hope that helps again. Of course, I don't see more questions. However, remember, if you have more, you know what to do. You can definitely get in touch with Maria. Let me just show the last one, of course. And if you wish to, you can just email me. I'll be happy to share her details as well. Someone is typing, so I want to make sure that we have answered all of your questions. But thank you so much. Cassie would like to say thanks to you as well.
Welcome.
So I guess we will be finishing. But Maria, it was great to have you. It's been a great topic for sure. Glad that we were able to discuss it. I do hope that you have found this useful, and thanks everyone for your questions. And again, I hope that was again helpful to you. And well, Maria, before we finish, any final words? As you can see, more thank yous are coming up your way.
Well, you're welcome. For me, it was really nice to do this talk, my first English talk, and I hope
you did great.
I could
for sure.
Thank you, and I really hoped I could help you, and it was useful. And from now on, you have like you are a little bit more orientated, because this is a difficult topic and very confused topic, and I think like knowledge brings calm, and calm it's always good.
Yeah, and from my perspective, it seems like, we always need to remember that everything is connected, that, microbiome, it's still connected, and you need to remember about this as well. So thank you so much indeed. And as you know, we will be back with some more events coming up. We will be back actually on Thursday, and this time we will talk about hysteroscopy and the role of hysteroscopy in miscarriage with Dr. Leah Secco. So I can only encourage you to join us on Thursday, 7 p.m. UK time again. This is going to be an interesting topic as well. So prepare your questions. You can ask them live as always. Maria, again, thank you so much for joining. It was lovely to have you. I'm looking forward to our next event. So stay tuned. We will talk about microbiome a little bit more as well. We have a webinar to schedule with Maria. So stay tuned as always. Thanks a lot, everyone. Thank you, Maria. And enjoy your evening.
Thank you.
Bye-bye.
Bye. Bye.